Now, as long as I've been practicing, there has always been contention between the physical therapists and the field of chiropractic medicine. Now, I don't know why PTs want to criticize chiropractors, but I know they have been all the way back to my days as an intern in 1998 through 1999. And me, I have no contention with chiropractors at all. I have several friends who are brilliant chiropractors. We have shared patients and shared knowledge about what we were doing, and usually I call them in advance to make sure what I'm going to do with manual therapy isn't going to undo what they did. So I've pretty much proven you can't have a collegial relationship with chiropractors. And generally, my experience has been they welcome working with physical therapists. What they don't welcome is when you get out of your lane and start doing grade 5 adjustments, which I'm going to say point blank, you are not properly trained for. You've never been properly trained for them. You should have never been allowed to do grade 5s. Oh, I know, the heresy. I get it, but I'm going to explain why. Because this is my problem with physical therapists. You're always trying to go into someone else's specialty and pretend like you can be an expert too with a few weekend courses. The newest rage of going to a few weekend courses and now sticking needles into people with dry needling, which is probably a topic for a whole separate video. But I have even heard therapists tell their patients when they ask them what they think of chiropractors, and the physical therapists will refer to the profession as a bunch of quacks. So let me get this straight. One, they're a medical doctor. They spend hundreds of hours learning how to do grade 5 adjustments, hundreds of hours in their internships under direct supervision, and they're quacks, but you spend a few weekend courses learning how to do it and you're not a quack. And this sort of ridiculous reasoning among physical therapists is why I can't stand most physical therapists. Because you dip into somebody else's specialty, you accuse them of being quacks, and then you don't even have remotely the amount of training that they do in that specialty. It's arrogant, stupid, and again, deluded. But it has been my experience over the last quarter of a century that most therapists are arrogant, stupid, and deluded. That's why our profession has devolved into the state of what it is. But allow me to refer to an email from a chiropractor that I greatly respect, somebody that I go way back with to my childhood days. And this guy, he is no slouch. He was winning awards as a student intern that other chiropractors with 10 years experience weren't getting. This guy knows what he's doing. So I finally sent him an email and asked him to write a short summary of why physical therapists shouldn't be doing grade 5 manipulations. And here's his response, and I'll refer to it a couple times. What he does is he calls end play followed by high velocity, low amplitude thrust. So in short, fast hands with no power. The joint either unlocks or it doesn't. The biggest concern are the ancillary structures. So if you unlock the wrong joint, you can actually lock up something else. Much worse oftentimes in another area of the spine or an extremity. Well, this brings an important point first of all. There are different methods of grade 5 adjustments even within the chiropractic profession. What do physical therapists know? They know to go to the end range, then do a thrust. Now, I know the response is immediately going to be, how do you know? Have you ever taken any courses? Yes. When I took the Colonel Kersey course, I think it's Kersey or Kernsey, at Baylor University when I was a civilian working for the military, it was a 2-week, 40 hours a week course, and we spent a significant time learning grade 5s. They kept it restricted to the lumbar and the thoracic, and their reasoning was absurd. They had this rudimentary method of deciding whether you were going to open or close the facet based on very basic physiologic movements. In the second series of courses where they had certain sections that involved spinal manipulation was the Maitland series. Now understand, both of these courses gave an overview of indications and contraindications especially when deciding whether you're going to do a grade 5. And then they would show a few basic lumbar and thoracic manipulations, and then you go practice on your table for about 20 minutes. And then they would just move on. Baylor's course was significantly better because at least we did it 5 days a week for 2 weeks. But still, we're talking about 2 weeks versus a chiropractor's training of hundreds and hundreds of hours. And understand, we're given an overview of when to do it and when not to do it, what the indications are, what the contraindications are. Which brings to my next point in the response of this chiropractor friend of mine. So, the C-spine is affected by everything above and below. Okay, we know that. Thoracic and lumbar as well. Stellate ganglion and vagus nerve have a huge sympathetic-parasympathetic relationship. Lower back pain is all modulated through a pair of ganglion adjacent to the lumbar spine. He says, look at the neuro and see how the ganglion are connected. And he says, I haven't even started into the sphenoid and all the nerves that are directly affected by that. Do you know how much of that we learned in the 2 courses I took that involved some sections in manipulation? Absolutely none. Nothing was never addressed. Again, they basically did an overview of contraindications, which usually involved about an hour of lecture, and then they went right to work, showing us the manipulations and having us practice it. Now, if you can't understand the basic comparison I just gave you of what we learned even in my 2-week course as a PT versus a chiropractic and chiropractic school, then I don't know what to tell you. Again, hundreds and hundreds of hours of training and practicing these techniques versus just a little bit of training and an overview with PTs. That's why most chiropractors are opposed to you doing this. But let's continue. He says we can get into the neuro as in direct, indirect nerve pressure, stellate ganglion, vagus nerve, etc., then the vascular component, which is also directly affected and indirectly affected. So if you don't understand the neuro, don't adjust. If the person is in sympathetic overload, how does that change your view of the patient? If they're in parasympathetic overload, what should you do? What about the chemical reaction post-adjustment? Again, guess how much of this was addressed in the courses I took? None. Not at all. Wasn't even mentioned. Did you hear what he said? If you don't understand the neuro, don't adjust, and we're never taught the neuro remotely on that level at all. He continues, the PTs I know all manipulate for pain, which is dangerous. Short term, it might give relief, but until a full understanding of the ancillary results, one must choose wisely. If you unlock joints, then do not instill proper function through various processes. All you did is further cement dysfunction. Although short time, it doesn't hurt. How many times did they talk about in the courses, if you adjust L2, what's the effect going to be on T11? If you adjust T11, is there an effect on the cervical spine? If you adjust the cervical spine, what's the effect on the upper lumbar? What happens a few segments up when you perform a grade 5 manipulation? Never once did anyone ever address that in these courses that I took. And don't forget, one of these courses was from the almighty Baylor, which spouts off research every other minute. Again, do you see why chiropractors don't want you to do grade 5s? It was funny because I knew a PT who was on his way to a weekend course in manipulations, and I burned a copy of this email from my chiropractic friend, and I asked him to have the instructor read it and see if he could answer any of these questions. You know what the instructor said? He said, I don't know. I don't know the answers to these. That's my point. You shouldn't be an instructor then. You don't have the training to be an instructor. And guess what? Neither do your professors in PT school. Again, that PT who referred to chiropractors as quacks, I think he went to the Ola Grimsby course. I think I'm pronouncing that right. And they have a bunch of manual therapy courses. Not all of them are manipulation oriented. But it looks like they have a basic manipulation course, an advanced manipulation course, and then one for the extremities. So you're going to take these 3 or 4 courses or whatever they are, and suddenly you're going to believe that you have the level of expertise as a chiropractor, again, who has studied it for hundreds and hundreds of hours. And the fact that most of you can't understand this is my problem with most physical therapists. And I can tell you from personal experience, when I went to the series of Maitland courses, what they were teaching with cervical manipulations was flat out dangerous. Once we had gone through the lecture part of indications, contraindications, basically the instructor showed us 3 different types of cervical manipulations for about 20 minutes each, and then he said go off and practice with your group. Luckily, there wasn't a whole lot of contention with me because my table refused to do it. It was nice to see a few smart therapists in the room. As a matter of fact, prior to me taking the course, because I wanted to take the course because it was the advanced method, and only a small section involved the manipulation part, I got into a back and forth email war with the head guy of the program because I told him that limited amount of training was completely negligent. And this is what he answered back with. He said that chiropractors weren't the only ones who manipulated, and that the course was very thorough in terms of instruction, making us competent to do these manipulations. And my next email was basically like, no, you're not. And then he writes, well, nobody expects you to be an expert when you leave the course. That's my point. He just proved my point. When a chiropractor gets his degree, he is an expert at doing grade 5s. And here's the head guy that basically contradicts himself in a series of emails with me because he's not living in reality either. It all goes back to my first point of thinking that you can take a few weekend courses and suddenly be just as competent in someone else's specialty who has spent years learning that specialty. And this video is only about the grade 5s. I could go there on other topics in physical therapy as well. Now, are there problems in the chiropractic profession? Yeah, there's always bad apples in every profession. And yes, I've known chiropractors who whip through patients just making a lot of money. As I said, no profession is perfect. But that has nothing to do with whether we should be involved in their specialty when we've had minimal training in that specialty. And if you PTs don't get that basic reasoning, rationale, and common sense of what I just presented, then I don't know what to tell you. I hope that chiropractors continue to lobby to get grade 5s outlawed in the profession of physical therapy. Because none of you are trained on the points that my pal's email just presented. But this is an example of physical therapists dipping into someone else's specialty, having a minimal amount of training, yet believing they can operate in that skill set, which is largely based on arrogance versus the skill set itself.